York Times, Paul. Paul is sort of a bastion of looking at what we need to do as physicians to be in compliance, to understand what's happening with the ever-changing landscape that's occurring with medical care, with skin substitutes, with durable medical equipment. So Paul, how did we get here?
Well, let's go back a little bit in time, about 30 years ago to 1998, when the first skin substitute was approved by the FDA for venous leg ulcers, and then about 2 years later was approved for diabetic foot ulcers. So we had two in 2001. In 23 years, we now have approximately 75 commercially available cellular tissue products, accompanied by about 350 HCPCS code, depending on the size. One of the conflicts that we have also is that the HCPCS coding committee just approved 14 new skin substitute products in April, and there were several more submitted in January, which were approved just prior to the June meeting, which will be formally approved sometime this fall. Contrasting that, we have maybe 100 different other products, and about 80% of them are rejected, while 100% of the cellular tissue product applications were approved. So we have this internal conflict between Medicare saying, well, we've got all these products and we're approving them, and yet now we're facing with another situation where we need to rein in the use of them. So what we had in the beginning of 2022, we had about $10 million a month spent on cellular tissue products, with a projected annual payment of $120 million. And since then, it's escalated even further, with $5 billion paid out by Medicare fee-for-service alone in 2023, and double that in 24. And who knows what we are going to see for 2025. So that's kind of where we are. And what's kind of stimulated all this when Medicare went from this a fee-for-service to high cost, low cost formula, and that drove a lot of providers to do this in their office, which are based on average sale price, plus the fact that there's no monitoring. So we've gotten to a point now where Medicare is saying this is the possibilities for 2026: a single bundle payment for cellular tissue product application and the graft, same payment regardless of which product is being used, a prior authorization program for any number of cellular tissue products or for more than maybe 4 applications, a reduction from 300 plus reviewed products to be reimbursed to maybe 16 as per the proposed LCD, which was put in place last year and then put on hold on. Another question is, will other third-party payers, including the Medicare Part C plans, follow Medicare fee-for-service? Will the supplements institute their own prior authorization programs in addition to the Medicare fee-for-service ones? And what exactly will the Medicare fee-for-service or others be looking for in your documentation to approve the use of the cellular tissue products? So that sort of encapsulates how we got to where we are right now.